Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about dental crown pain. Once you spend money and time in a dental crown, you cannot really imagine that a toothache can manifest, particularly if you had absolutely no pain before positioning of the restoration. However, this is a typical dental care problem. However, a toothache in a tooth with the crown absolutely does not show bad dental technique. Once substantial caries damages a great deal of tooth construction, a dental crown treatment ends up being essential. This surgery includes decreasing the tooth round to an impression of the setup tooth duplicates the left tooth construction, and a dental care laboratory makes use of the pattern to produce a porcelain or even metal replacement called a dental crown. A quick acrylic short-term crown mounted on the tooth safeguards it in the interim. After making of the restoration, a tooth cement seals the porcelain crown over the set-up tooth. You can find a number of factors a person may find that they have dental crown pain. The dental crown might be positioned improperly or perhaps badly attached, which could aggravate the gums or perhaps lead to tenderness in the close-by teeth. The affected person might experience discomfort in case a root canal is carried out improperly before the dental crown is positioned. A dental crown which has been in position for a long period can sooner or later contribute to the gums to recede. Certain individuals brush or floss too rigorous with the intention to look after the dental crown, which could after that result in periodontal discomfort in the area. Dental crown pain is usually the consequence of dental crown that does not lay on the tooth properly. This may occasionally happen due to the fact the pattern that had been created from or the genuine impression of the tooth was incorrect, or perhaps the maker failed to make it to march like it need to. The dental crown could after that irritate the adjoining periodontal tissue or even develop zones which are vulnerable to accumulation of microorganisms and consequently bacterial infection. It could possibly also sit very high, impacting the teeth above or perhaps below and also causing tenderness. Your dental surgeon are going to assess the path your brand new dental crown comes along with its opposite teeth before they seal it in position. Nonetheless, you might find, particularly after the numbness has diminished, that your crown's form ends up being hardly appropriate. You will probably find that your crown tooth reaches firstly after you pull your teeth to each other. Or perhaps when you push the teeth from side to side, it is possible to sense certain part of the dental crown appears too noticeable as too high. This particular issue is normally a simple repair for your dental surgeon. They basically have to polish your dental crown down, therefore its form is much more in balance with the bite. Don't hope this kind of issue to look after on its own, since it won't. In reality, if this type of problem is not treated in an appropriate time, it could lead to serious side effects, for example a requirement for tooth root canal treatment method. A tooth crown is usually put on a tooth after a tooth root canal is performed on it. In case the treatment is performed in the wrong way, the affected person might sense dental crown pain. Occasionally a little bit of the root pulp could be remained in the canal. Additionally, it is probable for the filling which is put into the canal to enter into parts in the tooth which will cause soreness and pain. One more reason for dental crown pain is recession of the periodontal line at the foundation of the impacted tooth. Sometimes it is an issue with crowns which have been in position for a very long time. When they are even a little bit ill-fitted, they might not produce discomfort initially but may press in the gingival tissue, provoking it to recede. Sooner or later, this could reveal a bit of the root of the tooth, resulting in tenderness and discomfort. After a dental crown is cemented into position, a patient might observe that their tooth is tender to warm and frosty foods and drinks. The area of the tenderness is generally right at the border of the dental crown, down by the periodontal line. As a clarification, it could be that the dental crown doesn't covers over the tooth as much as it optimally need to, most likely on the size so tiny you can't actually notice. It's this uncovered exterior that acts intensely to hot and also cold stimulants. Such type of issue could have a simple repair. The remedy could be as easy as making use of toothpaste that's manufactured as a remedy for delicate teeth. The active component in these solutions is often potassium nitrate. Or perhaps, the dental professional can make use of a solution to the tooth that can help to preserve as well as desensitize the subjected exterior. It's typical that a patient can observe certain elevated tenderness to hot and cold meals and drinks with their tooth that's already been mounted with the short-lived crown. It could be associated with a situation where the borders of a temporary dental crown usually fit over a tooth less accurately and completely compared to a permanent dental crown, consequently developing an area at the periodontal line in which thermal irritants could get at the tooth. Teeth with non-permanent crowns could go through just about all of the identical kind of issues like those mounted with the permanent dental crowns, and because of the limited use, non-permanent character of these restorations, several other kinds of problems as well. Exactly like with permanent dental crowns, if you have any kind of issue, you must be at liberty to report it to your dental professional to allow them to make an observation and therapy suggestion. People with dental crowns are usually directed to undertake additional look after that tooth along with the adjoining region, as it might be more probably for nutrition as well as other contaminants to accumulate there, making it vulnerable to bacterial infection as well as other complications. Occasionally people could be very excessively enthusiastic regarding cleaning, nevertheless, and damage the close-by periodontal tissue. This could cause discomfort, swelling and blood loss close to the dental crown. A temporary dental crown is set throughout that identical treatment when a tooth is originally formed for brand new dental crown. And because the border of the majority of crowns ending at or perhaps below the periodontal line, it's simple for a person's periodontal tissue to become roughed up throughout the dental crown, creating procedure. The aggravated tissue may feel a bit sensitive for one day approximately. As a cure, washing with hot salt drinking water, around 4 times each day, will help speed up curing. A tooth with a temporary dental crown could generally be flossed in standard way, with the following concern. Once flossing is completed, it might be wise to take away the floss, by way of allowing free of one end of it, after which you can taking it to the side. Moving the dental floss back up and out in standard manner could grab the border of the non-permanent dental crown and also remove it off. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedy Land. Take care.